seeing a path forward and looking to creating a more just and equitable Louisville. We've got some awesome speakers here, and I just wanted to focus us on the fact that we're moving from data and from studying our neighbors to using data to form partnerships and to assist our neighbors. So with that, we're going to kick it off with the awesome Dr. Jonathan Schwabish. I don't know if you can see him, maybe give a wave. His link to his podcast is in the chat. He specializes in communicating information through data visualization and presentation design, which sounds really cool. He's a senior fellow at the Urban Institute's Income and Benefits Policy Center. He also runs the PolicyViz blog and podcast, which the link is in the chat. And he recently published an article called Applying Racial Equity Awareness in Data Visualization. And Allie, if we can find a link to that, we can go ahead and put that in the chat as well. That article outlines several ways that data users can make visuals with equity, inclusivity, and accessibility in mind. So with that, Dr. Schwabish, the floor is yours.
Great, thank you so much. It's great to meet everybody. I would just want to make sure I give a shout out to my Urban Institute colleague, Alice Fang, who's on the call here. Alice and I have been working on this project for a while and continue to do so. And I'm excited that I'm able to talk about this project that we've been working on and some thoughts that we've been having about applying racial equity awareness in data visualization. And as Dr. Ansel just mentioned, to apply just and equitable framework in our communities, especially when it comes to folks who are working with data, conducting research, conducting analysis. It doesn't just apply to the words that we use in our reports or on our websites or in our blogs or in our tweets. It also extends to the visuals that we create that supports our arguments or the stories that we're making. And so in our efforts as data people to open minds and shape decisions and offer solutions, we need to be thinking intentionally about how we can learn from and speak to the communities that we're studying and that we're communicating with. And over the past several months, as we all know, the United States and parts of the world as well have started having, I think, a real conversation about race in this country, decades too late, I think, but we finally started to have what many would argue is a real conversation, and we'll see where that conversation heads. But in light of the murders of George Floyd, Breonna Taylor, and too many others, Alice and I and others at the Urban Institute have started to think about, I'd say think more strategically and purposefully about the words, the colors, the icons, the visuals that we use when we are communicating our data and our research. And before I get into some of the topics of this work, and because I only have a little bit of time this morning / afternoon, I'm not going to be able to get into the entire report, but I did put a link into the chat box to the blog post we just published and the full report. But before I get into that, I want to just share my lived experience with you because as a white male, and I've been adding middle age to the front of that, which I wouldn't have maybe like 3 months ago, but now I'm feeling more middle aged like every day. So as a middle-aged white male, I'm coming to this discussion with my own lived experience, and perhaps I'm not even the best person to be giving this talk. I'm a Jewish American, so I've experienced my own I've had my own experience with anti-Semitism, but I'm not a person of color. I'm not an underrepresented group in the same sense that we've been talking about for the last few months. And so the way in which I interact with police officers, the way I might walk into a store, the way I walk through the streets every day is going to be very different as a white American than people of color and other groups in this country. But I think as an economist, as someone who thinks deeply, and I try to be thoughtful about how I communicate my data through data visualizations, this is obviously a topic that strikes at the intersection of all of my work. And also, perhaps more simply and more honestly, just as a citizen of the country and as a dad to two young kids, it's important to be having these conversations. It's important to be having these conversations with as many people as we can. And one of the challenges I think that we have had in this country is that too many people are afraid or not comfortable with having these hard conversations about race and how we treat each other and how we treat the people that we are studying and communicating with. So this is a list of topics that we are exploring in this project. I'm not going to have time to talk about all of them, but just to give you sort of the lay of the land, as it were, about what we are thinking about, what Alice and I are thinking about as we're constructing this project and trying to give guidelines and sort of a rubric, as it will, of how people working with data might want to approach their work with a more racial equitable awareness. So we obviously talk a lot about language that we use, and we talk about ordering labels in a purposeful way. And I'll talk about that in a little bit, but when I give the sort of 30-second pitch for this project, this is the second part, is where I really focus, because for many of us who work with especially large data sets, especially large socioeconomic data sets, when we present results about race, we tend, I would say 99 of 100 economics, no, I'll rephrase that, 99.9 out of 100 papers, at least in social science, the results are going to be ordered white, black, Hispanic, other. And there's no other reason to present the results in that order other than that's how they show up in the data, and that's how they're coded 1, 2, 3, 4. And we don't really give more thought to how they should be presented. So I'm going to talk about language today. I'm going to talk about considering missing groups. I'll talk about a little bit. We in the paper talk a lot about color. We talk about using icons and shapes. We talk about these conversations with communities through demonstrating empathy and reflecting the lived experiences of the people that we are studying and communicating with. And then finally, something that we've been talking a little bit more about since the paper came out is considering groups and teams, and how a diverse workforce in an organization can feed into the analysis that we're doing, and the analysis and then feeds back into our workforce. So for example, if I'm doing a study on the median income of Black-headed households, the way that I present that information, I might benefit from being able to talk to some of my Black or African-American colleagues at the Urban Institute. And that then feeds into the analysis and how I conduct the analysis and how I think about conducting my research. If I don't have those colleagues or those partners in the organization or in organizations that we partner with, my analysis is ultimately going to be for the worse off. So let me talk about language, because this is probably the easiest place for many of us to think about this when it comes to data visualization. And I think that's because a lot of us try to think carefully about using language in the text that we write in and around the graphs. And you know, as an example, many people are now trying to use people first language. So instead of saying disabled people, we might say people with disabilities. We're also trying to get away from defining people based on the color of their skin. So we, for example, we might say Black people instead of Black or African American. Now, the problem or the challenge with language is that it's always evolving and it's always nuanced. Nick Steenhout wrote this really interesting blog post about disability language, where he made this point about how we refer to people with disabilities continues to evolve, and there's a nuance to how we use it, and that of course extends to all other groups that we're talking about. The one that I find really interesting is this word Latinx, which has in many areas has become a term that to describe the Hispanic or Latino population that's come to embody sort of a broader view to capture or to capture a broader view of the Hispanic population. But in an interesting survey that the Pew Research Center conducted in August, just a couple months ago, they asked Hispanic and Latino people in their survey their feelings about the word Latinx, and 2/3 of people in their survey said, now this is 2/3 of people in the survey who are Hispanic, who self-identify as Hispanic or Latino. 2/3 of people said that the word Latinx should not be used to describe that population. And so that to me is a startling finding, because there's been this sharp movement, I think, towards the word Latinx. And yet we're finding that people in this particular community, in the community that we are studying or communicating with, in this particular case, prefers not to use that word or that language. And so it's incumbent upon us, I think, as researchers and data analysts and data scientists, to try to talk to the people that we are studying to find out, is this the appropriate word, phrase, or term that we should be using to describe people? Because otherwise, we may be using terms that are not the terms that are preferred. And as an aside, I just finished this great book by a sociologist at Berkeley. His last name is Mora. The book is Making Hispanics. It's about the origin of this word Hispanic and the intersection of federal government agencies, the US Census Bureau changing their surveys, and the evolution of Spanish language television and the growth of and the evolution of that word Hispanic. So let me demonstrate what we're thinking about when it comes to data visualization and language specifically. So what I have here is a screenshot from a Tableau visualization. This is just the top third. What you see here is a map for Black people in the United States. There's another map in the middle for Hispanic people and a third map for white people in the United States. And so what you see in front of you is what's called a bivariate choropleth map. So a choropleth map, you've seen choropleth maps I'm sure you've seen many of them. A choropleth map will say shade states, counties, countries, zip codes based on a single color ramp. So might go say states with low unemployment rates have a light shade of blue to states that have a high unemployment rate with dark shades of blue. A bivariate choropleth map like the one in front of you uses two variables and plots both of the variables simultaneously. So I'm going to zoom in on the legend so you can see how this map works. So there's two axes here. The first axis is labeled on the original visualization more black, and going from on that top row from red to that dark purple, almost that black color. And then on the vertical axis, again in the original visualization, more poverty, going from say light purple to dark purple. So if we have where counties are that have a lower density of a Black population and a lower poverty rate, we're going to end up in that yellow shaded, those yellow shaded counties. So if you look in the thumbnail image, you can see kind of in the middle part of the United States, sort of that upper Midwest. And then in counties where we have a higher density of Black households and a higher poverty rate, we're going to be in those dark purple counties. So you can see again in the thumbnail image, sort of in the the southeastern part of the United States. But now let's think more about the language that's being used in this particular legend. Let's think about poverty along that vertical axis first. Poverty is an experience. It's not a static description of a person, right? I can be poor today and not poor tomorrow. So poverty is an experience. It's not a static description of an individual or household. And more to the point, Black references skin color, doesn't reference people. And if we want to have a more racial equitable awareness and lens to our work, we need to be thinking about how we communicate to people by describing people and not their skin color. So instead, perhaps a better set of labels for this particular bivariate choropleth map would be, and more verbose, more characters, but perhaps more equitable and more fair and more aware, is larger proportion of the Black population and larger proportion of people in poverty, right? We're here describing people as opposed to the static descriptions of individuals or households. And the other topic I wanted to touch on just briefly is considering missing groups. And when we wrote about this in the paper and when I talk about it, I really focus on gender, right? Because we have this, we've had this traditional approach to working with gender data as if it's binary, as if there's just two categories, there's men and women. But as we all know, gender is not binary. There's a spectrum of gender. And so I think that's the easiest way to think about these missing groups, that there's a whole spectrum here that's not being captured in many of our surveys. And we could take this a couple of steps further. I found this just the other day during the election, obviously. This is votes in Florida, and you can see the complete, two completely different perspectives on the two candidates in last week's election. Cuban Americans in Florida overwhelmingly voted for President Trump. Puerto Ricans, the exact opposite, overwhelmingly voted for Biden. But by combining these two together, right, and looking at the quote unquote Hispanic vote, we are missing these groups. We are missing the variation and the detailed differences between, for example, Cubans, Puerto Ricans, and Mexican Americans as well. And so now, as people who are downloading data and receiving data, we can't often do anything about this, right? When I download the census data, it's Hispanic is a category. It doesn't dive into these other categories. So it's a challenge, I think, for many of us who are just using data as opposed to us that are collecting data. But for those of us who are collecting data, I think we need to be thinking about these different subgroups spilling out of what we sort of call these aggregate groups or communities. When we do get into these aggregate groups, one thing that Alice and I have been talking about and struggling with is, what do we call the groups that are not captured on our data? And the standard typical way is to use the word other, which is problematic on the face of it, because we are literally othering these other groups, right? Which we want to avoid. But if you look at the definition of the word other in Merriam-Webster, it gives you the standard definitions as you would expect. But what struck me when I actually dove into the dictionary is this last definition. The last definition here is disturbingly or threateningly different. And I think that says a lot about the word other, about what that word other implies about groups that are not captured in the surveys, in the checkboxes that we're allowed to fill out when we take a survey. So I think there's an implication in our standard approaches to data collection that the other group is somehow disturbing, it's somehow threatening, and it's somehow not, and it's not the norm. Now, I'm not sure what the alternative is to the word other. One thing that we've been toying with is using the word another, which feels softer to me. However, it grammatically doesn't quite work. And so we're still struggling with this. We are trying to figure out, what is the right way to approach this. As one example, Alice and I just wrote a blog post yesterday about rates of food insufficiency across the states in the United States, differentiating by race and ethnicity. And there was a group in the data that we used. The option in the survey was other. And that was the word that we used because that was the word in the survey. That doesn't mean it's right. That doesn't mean necessarily that's the word that we should use, but that was the word that was used in the actual survey and the word that we decided to stick with for that particular work. I think we can all agree that when CNN used the phrase something else, I think we can all agree that that is, even as a white American, I'm insulted by the phrase something else. That takes this othering to another step. So I think we have seen over the past week both good and bad data visualizations relating to the election. This, I think, just sort of is beyond the pale as far as I'm concerned. So I don't have a ton of time, and I want to leave some time for questions and conversation. So I just want to wrap up how we wrap up in the paper, that data are a reflection of people. They're not just a sterile abstraction of experiences. We tend, I think, as people in the data visualization, the data science, the economics, the social science community, we tend to download data and ignore the fact that there are people behind those numbers, behind those ones and zeros. And I think the main thing that we can start to do, if we're not already doing it, is to start to reach out and communicate directly with the people that we are studying and the people that we are hoping to communicate with. And by doing that, we can try to better understand their lived experiences, try to understand where our language may not be reflecting their lives and their needs and their desires, so that our work can have a greater impact. So I'm gonna stop there. I'm gonna say thank you very much for having me. It was great to be here, and I have about 10 minutes or so for questions before I run to my next meeting. So thank you very much.
Thank you, Dr. Schwabish. That was freaking amazing. If you have questions, feel free to unmute yourself, or if you want to put them in the chat, and I can ask them, but please feel free to ask away. Right. Amy Shaw, you have a question?
Yes, I wanted to just appreciate your speeches and your information that you shared. And I wanted to say I agree with you about trying to find another word for this population of people that doesn't get accepted or included. So I'm not sure exactly if we can find a word for that in our current language, because it's not there. And I was wondering if you had any other suggestions about creating a word or coining something that would be appropriate and more pleasing
Ooh.
or more acceptable for people to use.
I love that. I love that idea. I don't. And like I said, the word another is one that I've seen in a couple of places, but still doesn't strike me as the right way. I mean, I would love to coin a new term or phrase. I think like I said, one of the challenges is when we receive data. So you all take a survey, let's just say you all take a survey, and the options from the survey instrument are white, Black, Hispanic, other. And some of you check that other box. Is it appropriate for me as the researcher or the person creating the graph, is it appropriate for me to change that word when I communicate my findings? And so that's something I'm struggling with too. I don't really know if I should change that word, right? I wouldn't change other terms in the survey. So I think it is more and more, I'm thinking it's incumbent upon the survey instrument to be more equitable. But it would be great if we could come up with a new word or term. And I'm just going to say one more thing. Alice is still on the call. So Alice, if you have anything to jump in on here, feel free. I will say when I was in graduate school, I had this desire to have an economics formula with the Schwabish lambda, which never really panned out. But that would be fun to have the Schwabish lambda come in here. So I don't know unfortunately I don't know the answer, but I do like the idea of trying to come up with a new word or phrase. It's a great idea.
Since all the data we're using that have these things I all rely upon respondent self-descriptions. Why don't you just put like all other self-descriptions, something like that? Yeah. And then it makes it very clear what the other categories are too, because they're also self-descriptions.
Right. And so we have, like, in the decennial census, both the current one and the previous one, you were able to write it for certain categories, you're able to write in a specific description. So, and for that survey, it really works because you could say all other groups as sort of a header, and then you could list, Mexican, Puerto Rican, Cherokee, Native American. I mean, you could list them specifically. The question is then, does all other groups work if the only category is that other? And that's the answer. And my instinct is that the only way to move forward is for us to, as the people using the data and communicating it, the only way to move forward is to change the word that we use. And maybe all other groups, all other races, I don't really know.
But if the category just says other,
right,
in every single case, in every single option, even if one option is just other, it's a self-description of the respondent. So other encompasses all other self-descriptions respondents may have of themselves. And so you could just put all other self-descriptions and you signal what the other ones are, white, Black, Hispanic, whatever, and you also signal that it's everything else anybody thinks of themselves in that extra category.
Yeah.
Do you have time for one more question?
I do, yeah.
Judy Jennings.
Thanks, Monica. I would just like to say about missing groups is that people who are incarcerated are totally often missing from the data and also have the greatest racial disparities, and that the carceral institutions and courts will not release data, and there hasn't been any much help from the data collecting community to break through this block on the local level or the state level or the national level. So what do you think is the role of data collectors in looking at this group of really important people?
Yeah, I think that's a great question. And it's one of those things that's kind of shocking to me that we're unable to count our imprisoned population. I mean, they are by definition in prison. You would think you would just be able to go and count. And, Bruce Western's really the only one who's done, Bruce Western and Kathy, I'm blanking on her last name, who've tried to do these. So, I think it's, as I mentioned with how the survey instruments, the language that the survey instruments use, certainly in the universe of who they're interviewing is also sort of an even bigger question. And I think we've seen just in the last week where polling data clearly has its own scientific problems. We know that in the economic field that a lot of our large data surveys are are having problems with more missing data and misreporting. So I think there is an underlying issue here that we're not trying to tackle, but there's an underlying issue with our data collection, the science of data collection. And I think that pervades all different types of fields and all different types of populations. And I think the imprisoned population is a great example of that, especially because of, as you mentioned, Judy, the racial disparity between especially Black Americans and white Americans in our prison system. Absolutely.
Do you want one more question or you need to head out?
No, I can take one more if someone has another question.
Ja'Cory, did you want to ask a question?
Yeah, I'll jump in here real quick. Peace. I'm Ja'Cory Arthur. I belong to a movement known as ADOS, the American Descendants of Slavery, where we look at lineage as a determining factor. That's kind of I would say, an intersection between race and ethnicity and really even nationality. And my question is about the new term or phrase BIPOC, which is, Black, Indigenous, people of color. Yeah. And how that phrase is really a throwaway phrase that doesn't tell us much of anything about a specific group of people. So in your professional opinion, would you say BIPOC or people of color or this new of color label is kind of meaningless in terms of data?
That's a really good, hard question. And honestly, I'm not sure I'm the right person to answer that question. Because as I said, my perspective is clearly different as a white American. I do worry a little bit that we are. Well, I don't know if I worry too much. I mean, I think the fact that we have these new terms and phrases is only good because it forces us to have the conversation that we're having, and so. So maybe I'll put it this way. The word minority is a word that even over the last, I would say 6 months, is a word that has started to very quickly go out of favor. And just by my reading of Ibram Kendi and Isabel Wilkerson and all these other scholars on race, when I see the word minority used in writing around race, it now strikes me as out of touch. There's a recent paper in the Journal of Economic Perspectives about race in the economics profession. And they use the word minority instead of people of color. And it strikes me as being out of touch. So I don't know if the acronym BIPOC will be something that evolves and becomes a term that we become more comfortable with. But I do appreciate trying to think about whether that is as you said, Ja'Cory, like a throwaway phrase. Like it's just this, I use this phrase and it sort of absolves me of any responsibility of thinking about specific groups and get this sort of overarching word or phrase that gets me off the hook of thinking about more specific groups and underrepresented groups. So. I'm sorry, I'm not sure I have more intelligent things to say on that, but I do appreciate you bringing that up, and I'm going to go take a look at your organization. It sounds really interesting.
Well, thank you, Dr. Schwabish. I want to make sure we're honoring your time. How are we doing?
We're all set. I have to run to my next thing, but I do thank you, Ja'Cory, for that. He just sent me the link, so I'm going to make sure I bookmark that. So I put the link to the paper or to the blog post we wrote on the report that you can all take a look at, and it links to the Open Science Foundation version of the full paper. And if you have questions, feel free to reach out to me or to Alice. We're more than happy to have these conversations, and I really appreciate the discussion and the feedback.
Thank you, Dr. Schwabish. That was great.
Thanks, everybody. Have a great afternoon.
Bye.
Bye.
All right, so for those of you that are not new to Data Nerds, you know that we're going out of order today. So we're just going to keep going out of order. Our next speaker, yeah, why not? It's 2020, hey. Our next speaker is Chris Stevens. He's GOP family, but he's also, he's a strategic data fellow for the Center for Education Policy Research at Harvard University, and he's a data scientist for the Kentucky Center for Statistics. He's going to be talking to us about and sharing with us current data that's available, or data that will soon be available at the state level, and how we can access it and use it for our needs. All right, Chris, you ready?
Thank you so much. Thank you so much. Let's see if I can navigate all the different screen sharing options that we're going to have here. Because it's 2020 and slideshows are hard for some reason still. But so I'm Chris, Chris with a K, if you're not paying attention to Zoom. So I work for KY Stats. I'm a data scientist. That is the Kentucky Center for Statistics. And again, it's a KY Stats. It's phonetically there below if you have questions about reasons why. I don't know why. That's what people picked. And so we went with it. We're going to talk about the youth and young adult populations dashboard. Now, because this is a Zoom meeting at lunchtime in 2020 during a pandemic, you are definitely also going to check your email and Twitter while I'm talking. So here's the report link. It's also in the chat. Click on it, look at it instead of your email. I promise you don't want to respond to whoever it is. It's not that big of a deal. They can wait 20 minutes. You need a break anyway. It's been a big week. It's been a big month. It's been a big year. So our goal with this report was we wanted to establish a dashboard that identified historically underrepresented populations, as well as equity issues and barriers to education and workforce using the Kentucky Longitudinal Data System, right? Well, the first question is, what's the Kentucky Longitudinal Data System? The Kentucky Longitudinal Data System is a program that was started back in 2012, where we take as much data as we can get, administrative data from sources in state government that already have all this information, and we start smashing all the data silos to try and integrate this information together. So if you have education data in this silo and workforce data in this silo, imagine them like two big Lego towers. We just push them together and then sort all the red pieces with the red pieces and all the blue pieces with the blue pieces, so that all that data lines up the way that it's supposed to. However, we're really good at data, right? We don't have the subject matter expertise to really dig into some of these things. So as we smash all this data together, we rely on people that are in the community, people that are available to like ask good research questions, to partner with them to make sure that we're asking the right questions and giving them answers that are helpful. So this is what the goal of this is, to put all this information together to create an accurate landscape of what's going on, so that we can partner with other agencies, identify strategies that work, and do some research around program effectiveness so that we can increase the effectiveness, bringing people out of these situations where they're underrepresented. So our initial target populations, these were set by some different people from different agencies. We started with low socioeconomic status, people that were corrections involved. So I believe Judy was talking about that. KY Stats has been able to break into the corrections like data silo. Corrections data is my own personal nightmare, so be careful what you wish for there. It's like asking for mercury poisoning a little bit, because it's like, oh, it looks cool, and then it's like not good for your mental health to go through it all. The homeless or houseless populations, unaccompanied youth, limited English proficiency, migrant situation, migrant children, or children who work for who have migrant parents, I should say, and special education. So one of the things that I want to put in here is special education is a very wide definition from KDE, right? Let me turn off something real quick. So it's a very, very wide specialization from the Kentucky Department of Education. It includes both people who are your traditional kind of population that you're used to associating with this, special needs populations, but it also includes people that just have learning disabilities. So if you were like me and you couldn't say your O's in the 4th grade, right, and your name was Quiz Stevens, like you have a flag as special education in the KDE workforce, right? And like I learned how to compensate and I can say my R's now and that's great. But that flag still exists. And so it's a very, very large term that hasn't really been broken down in administrative data well yet. So we are limited in our ability to report out accurately there because we are limited by administrative data. So first big question, how many Kentuckians are there that are age 14 to 24? Well, if you go to the census and you take 1/5 of the 10 to 14-year-olds plus all the 15 to 19-year-olds and all the 20 to 24-year-olds, you get 647,503 individuals, right, according to the census. So if you look at our report, we have 652,300 individuals in this report, right? We are well within the margin of error on total population for this group, the 14 to 24-year-olds. So we feel as though we have a really comprehensive picture of this 14 to 24 age range, right? So what does that mean? Well, it means that we think we have caught most everybody, but we know where some of our limitations are. So the way that we collected all this information was preschool through post-secondary education data. We have SNAP and TANF data, or SNAP and KTAP data that we have integrated into our system. We have driver's license data that we've integrated. We have birth and death data through vital statistics that we've integrated. We have adult education for people who've graduated with a GED. We have corrections data. All of these different data silos that we've crashed down into a big pile, sorted them out so that we have outcomes across all these different systems. What does that mean? Who's missing? Well, if you went to a private school, didn't get a driver's license, weren't fortunate enough to understand how to navigate SNAP and KTAP program guidelines, or lived in a family that had resources enough that you didn't qualify for SNAP or KTAP, you were born before our birth record started and haven't been in corrections, like that's the population of people that we're missing. For the most part, we believe that that affects a lot of private school kids who go out of school, out of state for college, right? But even then, we think we catch a lot of those with driver's license data. So what kind of demographics do we have? Well, we can disaggregate all of this information by race, gender, age, region being Appalachian versus Delta, right? So your two eastern and western ends of the state where there are economic hardships, like those different regions are spread out because there are partners that work in those regions specifically, and we wanted to make sure that we were able to provide at least high-level information to them on our first pass. Finally, we have urban and rural areas, as well as our local workforce areas, because a lot of our workforce funding is focused on local workforce areas. So we wanted local leaders to be able to look at those numbers and get ideas of what was going on. So everything seems to be outcome-based in these kinds of things. So we have 10 different outcomes. We have college and career readiness, CTE certifications, high school graduation, GED graduates, SNAP participants, KTAP participants, post-secondary enrollments, those who have earned post-secondary credentials, and employment 1 and 2 years out for the 2017 cohort, right? All of these different things are ways that we measure the effectiveness of programs. They're not always the best ways to measure effectiveness of programs, but they're options that are available to us as we try and help people process through what the program does, who it reaches, how it's doing, like what are the outcomes that are interesting to these individuals who know the programs. We also know that none of these populations exist in a vacuum. Because we have individual level data in the KLDS, the Kentucky Longitudinal Data System, we can tell if you are both low socioeconomic status and involved in corrections, right? We can tell if you were both a part of the houseless population, and also a part of the special education population, right? So if you have somebody who's going to go out and do work with a specific population, we have an idea about what other kinds of things need to be considered as you're doing this work, right? Of the 10,000 people who were involved in corrections in any way, shape, or form, 30% of them were houseless at some point during their Kentucky Department of Education career, right? So there are things there that people that are going into the community need to know and they need to be aware of as they're doing this work. So we try and help fill out some of that information. So that's like a brief overview of the report. I'm hoping that you've all been clicking along, finding new things that are in there. We exist to be a resource with this information. If you work in these areas, you know more about these areas than I do, guaranteed. I'm really good at making a spreadsheet dance and sing and all these kinds of things, but you're the one with the subject matter knowledge. You're the ones who teach us no, this is now the right terms. These are the things that you need to consider. These are the things that you need to know. There's lots of institutional knowledge in the community, and we want to tap into that to make sure that we're putting out things that work.
Are you finished, Chris? I want to cut you off.
I am.
All right, that was great. So we have a few moments. Would you like to go ahead and take questions now, or would you want to wait?
I will gladly take them now.
All right, so if you have a question, you can go ahead and you can let me know in the chat, or feel free to unmute, whichever works for you. Well, I have a question, even though I could speak to you later on this afternoon. For those of us in the advocacy space, how would you, if we have a question about data that we cannot find, do you know who we could contact, or is there someone to contact?
So I would love it if people contacted me, because I want to know what questions people are asking. I want to know what's important in the communities that we serve. I want to be able to answer those. My email address is pretty straightforward. It's chris.stevens@ky.gov, and it's in this chat. So feel free to email me. We have on a section of our website under request data, there's a data dictionary download. It's an Excel sheet that has 1,000 different metrics that we can report out. If you ask us a question, right? Everything across all of those different areas that we talked about already that are included in the dashboard. A lot of those things, we can just run an aggregate file. We'll give you the list of caveats that come with it, because all administrative data has caveats. And we can try and help inform that missingness of data. If you have very, very, very specific questions about a potential cohort of people, we can answer a lot of those. It takes a little bit more paperwork because all of this data is available, which means I'm in there, right? And I don't have a Facebook because I don't really I even called it a Facebook. That's how much I don't enjoy Facebook or a lot of their data practices. So it's important to me to make sure that my information is safe. So it's also important to all of us that work there, because all of our information is also in the KLDS. So data security is our #1 thing, because I really, really would prefer that you not have the ability to look me up. You can find me on Twitter if you want to, but there it's mostly stupid jokes and baseball jokes. But otherwise, I try and keep a pretty low data footprint for these reasons.
We have some props for data security in the chat. Are there any other questions? If not, hopefully we'll have some time to come back to questions if that's the case. But that was a great job, Chris.
Well, I had just a short one. I've done. I had a project where I got extensive data from when it was called Kentucky Center for Education and Workforce Statistics, before it was rebranded, and doing on data on what for the Kentucky Lottery Corp for what effect Keys money had on decisions of students to go to college and then continue on to their second year and eventually graduate. And the big problem I had was that I had a dump of everybody who graduated between 2000 and I think maybe 10 and 2016. And so the big problem was there was so much missing data on a lot of things I had. And then there was the thing the big roadblock I had some really good results, but the big roadblock I had was I couldn't get data on family income of students because I kept getting blocked by the the privacy laws. Even though the privacy laws, there are clauses in there that say you can give certain kinds of information for research purposes. And so all I wanted was like block group of their home, so that I could then import census data and get a rough idea of family income by the block group that each student lived in. And I was never able to get that because I was told that the KY stats, that the data comes to them already with that stuff all stripped out, and so there's no way they can go back and get that kind of data. And so that's a big problem for people doing research like I was trying to do.
So if you made that request, I would assume that it was 2017 based on the cohort that you got, or 2018. In the last 2 years, we've integrated a couple of different things. We've integrated geocoding all of our data to census tracts, so you can't get blocked, but we do have a lot of data to census tract with a really, really sound research question that lawyers both agree doesn't violate anything. So that's like another layer of data security, is a legal team that just picks apart all of our data requests to make sure that we're not doing anything untoward. The other thing that we have is we have started integrating in revenue data. So we are able to start looking at family IDs, because before it was always just the individual and we could never link people, like families, together, right? So like we would have an income of one person, but if there are two people in the household providing income, we can never blend those things. With revenue data, we're starting to look at what we can explore there in terms of bringing together families and being able to look at family outcomes, not just individual outcomes. So hopefully, as this is all very, very new, we're still exploring it on our end to see what is possible, whether or not we like in terms of, do we feel confident that we're getting good family matches? Not necessarily do we have feelings about the outcomes. So we're going through that process now to try and see how much of this data is useful and how much of it can be made available and in what context.
It sounds like, that sounds great. It sounds like that it would be a lot easier for me to do what I was planning to, what I ideally wanted to do a few years ago. Now, if someone will pay me to do it now, then that would be great.
We will happily go along with anybody writing grants to do more of this work.
All right, I think we have one more question. I will say this, ladies, don't be afraid to unmute. All right, we don't have to ask permission in the chat to have your question asked. So Amy Shaw, you have a question?
Yes, I'm a student at U of L doing some data science. I'm learning business analytics. And I was wondering if students like myself or my group of students that I'm working with in my class wanted to get the data. It looks like you just have to request it. Is that right? I looked on the website and I thought that's what you had to do.
So you can request it. I would love to walk through that process with anybody who wants to do that, because there's a lot of back and forth, and I would like to answer your question the first time with the data that you asked for, and not us send some results or send some aggregate files, and then there's an analysis process, and then you get halfway through and you realize, oh, this doesn't answer the question that we want to answer.
Do we need to have a really clear research question before we approach you? Or, because I don't know what the data looks like, so I'm not sure what my question would be.
So a clear research question is most helpful for requesting data. But we 100% are always looking for more people to use our data. And we also actively are looking for people who are really, really good at data talent. The reason why I got in at KY Stats is because I kept building dashboards and asking for more data. And finally, they just offered me a position so that I didn't have to ask anymore.
Oh, that's great. Well, I see it takes 4 months to get the data, so I guess it's better to really have a plan in place before we request something.
Mm-hmm. And I'd be happy to work with anybody on your group on putting those things together.
Thank you.
Thank you, Chris. That was great. And thank you for making yourself available as a resource. All right, our next presenter, I do not have a bio for him, but I can assure you that he is awesome. He is GLP's own data science wizard, Harrison Kirby. You ready, Harrison?
Yeah, I am. Thanks, Monica. Let me see how I can share my screen here. So I'm going to be talking about a project that I've been working on. My presentation will probably be the least pretty presentation today. But this is just kind of about a project that I'm working on. I'm also interested in any kind of feedback that you all have about this. Can you all, is this like presentation set up okay on Zoom? Okay.
Looks good.
Cool. So overall, the Greater Louisville project, we're working on ways to put our data in people's hands and make it as usable and as relevant as possible. So one important piece of that puzzle that I've been tackling is how do we take some of our data, which we have grouped by neighborhoods, by census tract, by other area, and make it so that we can talk about it at the Metro Council District level. Since that's what a lot of elected officials care about, we think it's a good way to help kind of inject it into the conversation. So I'm going to talk about a little bit about the process that I've been going through, and then open it up to you all for questions or feedback about how this might be useful to your all's work. So my goal, in order to use a lot of our GLP data at the Metro Council District level, is to convert from census tracts, which is the grouping on the left, over to Metro Council District, which is the grouping on the right. As you can see, there are 191 census tracts in Louisville. So how do we like group them and allocate them properly to Metro Council districts? I'm going to kind of talk about this process for one census tract, just kind of picked randomly, which is this one, a large part of the Butchertown neighborhood. This is census tract, you could call it 74, or just say all the numbers in a row. But it's split across 2 Metro Council districts. So say we know that there are 1,000 kids in this census tract who don't have access to internet. How could we summarize that according to these 2 Metro Council districts? An initial pass, you might say, oh, probably like 80% of those kids live in Metro Council District 9, and maybe 20% live in Metro Council District 6. However, census data has a finer level of geography than we usually use, and that is block groups, the chunk in the middle there. So I started looking at these to wonder if we could maybe get more accurate than census tracts. This shows that that tract contains 2 different block groups, the one in the blue and the one in the pink or orange. We could probably debate that color for a long time. But essentially what this shows is that about half of the census tract is in the blue area and about half is in the pink. So if you compare it side by side to the Metro Council districts, you might think, oh, if half of the people live in the blue area, maybe like 90% of these kids would be in District 9, and maybe like 10% would be in District 6. But you could add another layer onto it, which is zoning. So looking at where in this area people actually live. This map on the right shows areas in Louisville that are zoned for single family, multifamily, or residential. Of course, there are definitely exceptions to this. There are probably folks who live outside of it exclusively for those uses. There are tons of special cases, but I think that this would get at a pretty good level of accuracy for this project to work. So if you smush all of those things together as an in-between step, Would you see that this tract is actually mostly zoned for non-residential use? A lot of this is along the river. There's some manufacturing, some industrial. So the area on the left, which is District 6, doesn't actually contain any of the blue area that's zoned for people to live in. So based on that, we could pretty much assign everyone who lives in this census tract to District 8, the one on the right. I put an asterisk by no because, again, there are definitely cases and examples of people, in particular, as we've been talking about, folks who are excluded from the usual data collection process who actually do live in District 6. But for data purposes and with the level of accuracy that we're talking about, this gets us pretty close to the end. There's a little bit of cleaning involved. So this is an example of how census boundaries in Metro Council districts don't always align. So there's a little bit of cleaning. But this is kind of an initial result of what I've been working on. So this took census data about children in households without high-speed internet and a computer. I looked at where those children might live throughout the city. This is colored, themed based on a path forward, which is how I chose this color palette. What we can see is that areas of downtown, Metro Council districts 5, 4, 6, and 15 have a large proportion of children without access to high-speed internet and a computer, and it varies based on district. I don't think that the shading is the most helpful to tell things in the middle, but if you're looking at, say, a table of data, you can see that, you know, we estimate 300 kids in this Metro Council district and 1,000 in this district, et cetera. So my next step for this project would be to incorporate block data, which is another product from the census. So for example, this is a map of the blocks in that district. It might help us get a little bit more accurate estimates. Other next steps include figuring out the error involved in this process. And that's important so that we can know what claims we should make and should not make based on the data. If we, you know, reconfigure all of the data, can we look and say, oh, things have improved or not improved, or is there just too much error involved to be able to do that? And lastly, create a tool to help people use this work. So talk to people about what data they have and what data they want, and is it possible to use this work in between? Not everyone works at the Greater Louisville Project and has a ton of data at the census tract level. So my question would be, what kinds of data do people have? What kinds of data do people want? And how can this be most useful? So going forward, I'll be kind of working on this project, making a prettier presentation, and would appreciate anybody's feedback on it.
This is really cool, Harrison. So with that, let's open it up to questions. Anyone has?
Let's see. There's a question from Denise. Is this, it says Chris, but is it towards me, I think?
Yeah, hi, it's Denise. Yes, I meant it for you. I apologize.
Okay, you're good. So it's West Louisville is so defined by neighborhood and not by census tract or Metro Council. How can we get access to block data? So I'll break that up into two parts, which is one, defined by neighborhood. We summarize data by different neighborhood groupings on our website. So we can definitely help with that. And we'd like to publicize this Metro Council district data alongside those other areas. Mm-hmm. Census tracts don't always align with like the neighborhood boundaries that people in Louisville actually use. So sometimes there's a caveat there, but by and large they do. How can we get access to block data? It's pretty complicated to get it from the Census Bureau, I find. You know, I can send you the website and set anyone up with kind of like a toolkit. And maybe that's something that we should make available. How can people access data through the census website? And we also provide raw data on our website. So my dream would be here's a map of, say, children without internet. You can group it by neighborhood or census tract or block or Metro Council District. And also here's an Excel file where you can download all that information if you want to do it differently.
Is there health data in the block data?
By and large, no. Unfortunately, the census collects a lot of data about people's living situation, housing, earnings, work, but it doesn't include much health data aside from health insurance.
Got it. Okay.
Are you getting your block data through special requests from the Census Bureau? Because I know block group data is from the ACS is accessible, but usually block is only associated with population counts nowadays. So I was wondering how you're getting down to the block level.
Yeah, that's how I'm using it, is just using block data for population counts to provide better weights for block group level data.
So is none of the, as far as you know, none of the usual data that's released for block group and census is available at the block level anymore? There's just too few in the samples, survey samples nowadays. Is that a problem?
I think so, and I think that the data privacy would probably come into play there, because population counts for blocks come from the decennial census, and it's usually like 50 people or so. So you can really describe those people without revealing personal information.
Yeah.
Thank you, Harrison. That was great. Of course, I know, Harrison, I don't know if your email is known to everyone, but are you available if people can reach out by email?
Yeah, absolutely. Any feedback or anyone who would be interested in using any of this, I would love to hear from. I just threw my email in the chat.
Thank you. So now let's go back to the beginning of our meeting where we usually begin, where we're going to introduce ourselves, even though we're all family. So we're going to go around. I'm going to try to just go across the names as they appear on my screen. Just tell us who you are, who you're with, what's the coolest thing you and or your organization is working on right now. And our best question, if you could magic the answer to any data question in our community, what would it be? And Harrison, you're on deck.
Cool. So my name is Harrison Kirby. I'm the data scientist at the Greater Louisville Project. The coolest thing I'm working on is probably the Metro Council District thing. If I had to pick something else, since I just presented on that, I'm getting back into home loan data today, which is very rich and very detailed. So essentially, almost every home mortgage, there's a ton of data about it individually that's public. So we can learn about our community that way. And if I could magic the answer to any data question, I will just pull from my presentation, which is how can we use data to make claims about changes over time in our community at the Metro Council District level. Hopefully I will magic that answer sometime within the next month.
And I forgot, I probably should introduce myself. I'm technically, I'm Dr. Unseld. You can call me Monica with the Greater Louisville Project. I'm working on an organization called Data for Justice, which I think is pretty cool. If I could magic the answer to any data question, it would be, how can we best create the comparison between community investment and police budgets to show which is more effective at reducing crime and violence? All right, Mr. Barry Kornstein, I'm sorry.
You're muted.
The quote of 2020, you're muted, Doc.
Sorry. Kornstein, although there's debate among my family. So I'll answer it to either one. I'm a longtime data user. Right now I'm a self-employed consultant. I've been working, I do a lot of economic impact studies. I did a lot of the pioneering work in the city with all the peer cities, the peer metro areas, all that stuff. The Great Louisville Project was born out of, came from work that I did at the University of Louisville with Paul Coombs, and I've done work on human capital, education, all kinds of stuff. I'm quite willing to collaborate with anybody that's any of you little people on my screen. And right now I've been doing work on tax revenues in Louisville and its peer metro areas, and very interesting findings there. And I would love to do more of it if I can find someone to help me make a living. And I don't know what would be my, I guess what I would really love to know is I need would be the relative tax burdens by income and race in the metro area would be what I'd really love to be able to work on it and figure out.
Thank you. Amy? She's still, let's see. You're muted, Amy. Are you trying to speak? Okay, well, let's try Margaret.
Hi, Margaret Pennington, work with Reach Evaluation. We typically work with data associated with health issues or educational issues, although we are sometimes broader than that. One of the most exciting things we're working on right now, actually it's a colleague of mine who may still be on the call, Teresa McGeaney, and her work in trying to be more creative and more dynamic in the visualization of some of the data related to heroin and other drug use. So.
Thank you.
And,
oh, sorry.
And the question, Monica, I'm going to steal yours. I think that was wonderful.
Thank you. And I like your earrings. I can be very shallow. So let's just keep going. Please forgive me if I mispronounce your name. Rochelle?
Exactly right. Thank you. Rochelle Seeger. I'm working now since 2013 at the Foundation for a Healthy Kentucky, a statewide health conversion foundation. Working on lots of fun data things, but the thing I have going on tomorrow is a part of the training series that I coordinate called Health for a Change, and it's webinars. And it is a self-care webinar, just 30 minutes with Dr. Cree Dry of Western Kentucky University. So that is awesome, and my price point is free. Also, speaking of free, November 2019, coordinated a data forum that my organization and another health foundation put on in Northern Kentucky. And we brought in Dr. Homer Ventners. He was a medical director at Rikers Island Prison for a number of years, is doing lots of work around COVID-19 in our jails and prison systems. And I have 10 of his books, people. Life and Death in Rikers Island. His Appendix A has a list of 10 things that need to be publicly available for our prison system so that we can improve health in the jail system. Please directly email me your email if you're interested in a copy of that book, and somehow I'll get you a book. If I could magic the answer to anything, it's the thing I always say here on this call with all of you folks is our systems, be it our police force in Louisville, our state Medicaid system, our hospital systems, need to have transparent data about what is happening so that we can improve health for all people. That's what I want, open data and publicly reported data.
Thank you.
Glad to be here today.
Chris Stevens?
Hi everybody, I'm Chris. I've taken up a ton of your time already, so I still work for KY Stats. I still do work there on reports and dashboards and research. The coolest thing that we're working on right now is the Family Resource Simulator. There was no real good overarching landscape of the way all the different social benefit programs work together in the state. So SNAP, KTAP, Section 8 housing, vouchers from the housing department, the all of it, LIHEAP and earned income tax credits and like 17 other programs. So we went through and partnered with some folks to put that all together, and it's live right now. So we're really excited about that. We're going through and trying to make sure that we didn't miss anything, because it's a lot, and I don't want to miss any populations in this kind of thing. I think it's really important work, but it gives us a starting point for conversations about the benefits and effects of these programs. If I could answer anything, if I could answer any question with data, it would probably be who all takes part in all of these different programs. Like, we've built the theoretical on what it should look like. I'd like to know what like utilization of all these different programs are by people in the community.
Thank you, Nate. Dr. Kratzer?
Hey, I'm Nate Kratzer. I'm a data scientist at Brown-Forman full-time and then part-time at Greater Louisville Project. Coolest thing I'm working on right now is a report around housing data, and specifically risk around evictions and so forth. And related to that, we have at best right now sort of, the ability to look at various census indicators and think about where are their households at risk, how this might affect people, what housing insecurity is like, but we don't really have direct evictions data, even though most of these court proceedings are open. And I think the scale of evictions isn't that widely known. So I would like us to have open eviction data, preferably that we give to Eviction Lab, so that we can, compare it easily across other cities and so forth. So getting that eviction data in place, and I know there are some people, actively working on this that have connected with some, so I'm hoping that will bear fruit, but obviously the administrative office of the courts has been rather slow in terms of giving anyone access to data. So that's what I would magic. I would speed that process up a lot.
Brittany.
Hi, thanks, Monica. So my name is Brittany Dr. Green. I'm a new assistant professor at the University of Louisville in computer information systems. And so I just graduated from Cincinnati. So some of the work that I'm still connected with them on is determining how can we best use analytics and data science to tackle food insecurity and hunger. So with that, and we're trying to get data that's disaggregated to the local level, incorporating the margins of error and looking at that over time, in order to provide actionable insights or operational interventions to nonprofit groups and organizations. So we're kind of like want to be like an operations group. So with that, what data at the local level and how is it broken down? And what is needed to provide actionable insights for different organizations, as opposed to just looking at data from the state level. So that would be my.
I'll be emailing you later. Yeah, get some people you may want to talk to. Jared.
Hi, everyone. My name is Jared Schwartz. I am a data analyst with Dare to Care Food Bank. So actually, I'm also working on food insecurity. I'm new to Louisville as well. I just started here at Dare to Care in June, and it has been interesting because I'm the first person in this type of role at Dare to Care, and so there's a lot of house cleaning that's been going on. If I could magic the answer to any question, I would love to have a model for what food insecurity is going to look like here coming out of COVID. We know that the economic impacts are far-reaching and probably not going to go away soon with the vaccine. And I would love to have an answer to that question. And right now, I have no idea. So,
Patton.
Hi, my name is Patton Mahler. I am an associate professor of economics at Center College. So not anywhere, I mean, close to Louisville, but further than the rest of you all are, I'm sure. I think the the best thing that center is producing is students like Harrison. And so I'm interested in part, so Terry Tolan, who I've worked with some stuff on related to early childhood in Danville, invited me to this meeting. And I'm interested in continuing to make connections with organizations that might use econ students to do things other than finance and investments. And so I'm just glad to meet you all. And I guess if I were to try to think of a data question I'd like to know the answer to, and in my community, I'd like to understand where kids between the ages of 0 and 4 live and what they're doing during the day, that we're really trying to work on kindergarten readiness here. So thank you all for allowing me to share this time with you.
Judy?
Hi, I'm Judy Jennings. I'm with the Louisville Family Justice Advocates. We work with families who have incarcerated loved ones in the Louisville Metro Jail. Right now, video visiting has been closed since March 13th. The average stay in the jail is 28 days, and families don't have a way to communicate with their by voice, communicate with their loved ones unless they pay $9.99 for a collect phone call. So we're trying to persuade the jail to give 2 free calls a week, a very modest request to these families. And so if anybody wants to help me, send me a email and I'll put you on a list. And my magic question is, how many of the 1,200 plus people in the jail right now have dependent children? And I think that would really relate to your child care question.
Katie.
Hi everyone, my name is Katie Elliott and I am a month in my new role as a senior data analyst with Kentucky Works within the labor market intelligence team. It's been an exciting time. So one of the things I'm the most excited about right now, today's message was so important because we are working on a dashboard that we're going to have on the website to showcase the demographics of those that we're serving within Kentucky Works with a lens on racial equity and inclusion, to see where we are and to see where we want to go with that. So we're going to be starting with the most recent program year and then look back on more historical data to be able to do that. And on the last part, when it comes to things that we're looking for answers to, we have one of the main things that I'm doing is trying to, along with, of course, Sarah, the director, is to bring in data from we're trying to get a clearinghouse of about 6 to 8 different systems that do not speak to each other, to bring the data all into one system. So rather than going through a lot of different places, we can pull a lot of reports in-house. And so that's one of the things that we're trying to figure out and to do well, and will be my challenge for the next year or so.
Thank you, Stephanie.
Hi everyone, I'm Stephanie and I just started with the James Graham Brown Foundation here in Louisville. The coolest thing I'm working on right now is an annual report for our scholarship programs. That's been really fun. And if I could magic the answer to any question, it would be, in Louisville, which organization or type of organization is the most effective for citizens to fund if they want to assist in long-lasting change for racial equity?
Jenny?
Hi, I'm Jenny Beekman. I'm with Jewish Family and Career Services. Coolest project, we are just now beginning a process of developing KPIs for our programs and are doing program evaluations to get the conversation started. It's a long road, so I'm excited to get started. To magic, I was gonna say what Jared said, so I'm off the cuff coming up with a new magic thing. We obviously had a lot of clients come to us at the beginning of COVID and still are seeing an increase in numbers. And we keep just saying the reason is COVID, and it would be really nice to have really specific data on what happened to each individual so we know exactly what our clients are going through, because we offer a lot of different types of services. So a home care client isn't going to have that same experience that a counseling client might need or anything like that. So some specific data on what happened that led them to us.
Kathy?
Hi, everyone. I am Kathy Kuhn. I am the new executive director of the Metropolitan Housing Coalition. So I am also really new to Louisville. I've been just about a month in now in this new job. So I've been really trying to meet as many people as I can and get up to speed on what's happening. So we're doing a ton of exciting things. It's hard to choose just one. One is actually with Monica. I just got involved in a group that is talking about how we can sort of dig into eviction data, but also sort of thinking about it from the landlord perspective and what's kind of driving some of those decisions when landlords decide to go forward with an eviction. And I just want to put a plug in for the land development code reform, which is there's a lot of movement on that right now. We're going to have some public hearings coming up at the beginning of December, and it's obviously so kind in terms of the way that our communities are developed. So want to put a plug in for that, and I'm going to just kind of second what Nate said about the eviction data. And Nate, I would love to connect with you around the work that you are doing, because I also agree that that's going to be so critical that we're tracking those evictions, particularly as these eviction moratoriums end coming, you know, at this point at the end of December. So thanks, everyone. It's great to be here.
Teresa.
Hi, everyone. Teresa McGinney. I'm an epidemiologist at Reach Evaluation. So I work with Margaret. And the most exciting, so I primarily work with behavioral health data, but do a lot on various different topics. And the most exciting thing, I'm going to echo what Margaret was saying. I'm really excited about this visualization. I keep calling it my data story, focusing on opioids right now, but we're hoping that it will be a template for the next one will probably be focusing on racial equity and disparities in behavioral health, and hoping to have a series of these where you can drill down to various geographies within the state. I saw, hi Dave, good to hear another behavioral health data nerd in the house. If I can magic, so I think I've been thinking a lot about politics, obviously, and feeling frustrated with our political system. And I have been really, I mean, I don't know, when we're talking about like inequity and all of these things, it just feels like we've got so much data out there. Like we know the problem is not enough data. It's how do you impact people's decisions and people's beliefs, and also politicians. And so that's kind of where my head is right now. Like how do you have an impact, kind of like an advocacy angle. How do you actually have the impact with the data that you've got?
David Gray.
Hey, first time joining one of these meetings, so thank you for having me. Nate Kratzer actually invited me. I work for Brown-Forman. I'm a senior data scientist, and I work in the global production side of the company. Coolest project I worked on recently, and I'll describe it kind of vaguely, but building data pipelines and reporting tools for our production sites so they can actually look at what's happening real time and make decisions on the fly. If I could answer any question with data right now, I'd want to understand the full economic and social impacts of climate change. I feel like that is a really big threat.
Dave Mattingly.
Hi, mic working? All right, looks like it is. The camera I'm using for this has no video, so just imagine a very handsome guy and then imagine the opposite of that, and that'll be me. Work at Baptist Health in the analytics department. The coolest thing we're doing right now is working on we're calling it affinity groups. It's almost like a data recommendation engine of, hey, you have used these apps and dashboards to look at this kind of data. Your peers have been using this other one that you have never visited, or only once, and they do it 10 times a day, stuff like that, to get people using the things that are most relevant to them. If I could magic anything, it would be related to food insecurity, but more on the immediate needs. Basically, I think the stat is Americans throw away something like 30% of our food, the edible food. Find a way to get leftovers or stuff that is still edible, but I'm about to throw away. Who on my block is hungry and could use it? Almost, I sometimes call that leftover B&B.
Thank you. Allie?
Sorry about that. Hi, I'm Allie Goldberg. I could turn my camera on, how rude. I am with Greater Louisville Project and also my own company, Aristify. Coolest project that we're working on right now at GLP is trying to figure out the user experience and how to kind of do what Dave was saying, which is suggest the next data that you want and make sure that we're giving the community the information that they need. So we're doing some studies and analysis about how you're using the data, what data is still needed. And if I could magic one thing, it would be to find out how everyone has leveraged data to accomplish things in the past and what they want to use it for in the future. That's what I want to know, please.
We'll bring this back around to our fearless leader, Ben, who wants to wrap it up. He can.
I'm Ben Rayner-Weber. I'm the director of the Greater Louisville Project, and this is my favorite thing that we do as GLP. The coolest thing that we're working on right now is we have gotten board buy-in to break out our annual report into a series of mini reports that are much more driven by community needs. So if you have questions that you want us to be pursuing, we have a much more flexible framework to be able to do that on a shorter time frame in response to what you're looking for. So that's super fun. A little daunting. Turns out the community has some feelings about the data that we are using, and we want to really respond to those. So that's fun. It's scary. And I'm looking forward to leaning into that. If I could magic the answer to what I want is a disaggregation wand. I want to be able to be like, bing, and by census tract, bing, and by demographic. That's what I want. So we're working at that where we can, but that's my thing. So I'm just going to wrap by saying thank you so much to all of you for being here, and particularly to our Dr. Unseld for helping in all the million ways that you do, but particularly facilitating the conversation today. And I hope you all have a great rest of your day.